Well, Richard is just the perfect candidate. He is a gentleman in his 60s who's been very happy with his appearance for a long time. He's a confident, funny, and interesting person. You know, basically his main frustrations had been that, you know, his grandkids kept, you know, jiggling his loose skin underneath his neck. So those are like the perfect reasons for someone to undergo facial plastic surgical procedures. When he came in, we looked at obviously the area that he was most concerned with, which is the area underneath the neck. But he also had a lot of hollowness in the cheek area that was also creating an imbalance for his face, and a lot of dynamic lines around his eyes and forehead. Obviously, we want to address the areas that he's most concerned with, which is his neck. But in analyzing his face, in order to create a natural look, we need to balance the whole area, meaning we got to balance the forehead with the mid-face, with the lower face and neck. Otherwise, people get an unnatural appearance. So in analyzing him, he also had a lot of hollowness in his mid-face area, and he had a significant amount of expression lines around his eyes. So a plan essentially was created for him to address his neck with a lower face and neck lift, to add volume to his mid-face area with fat grafting, and to address the expression lines with Botox, because that's what works the best for expression lines around the eyes and forehead. So during Richard's surgery, we addressed all of these issues. The key aspect of this operation, especially in a man, is that the results cannot be overexpressed. It cannot be exaggerated. It's got to be subtle, because otherwise men will look awkward.
That was one of my biggest worries, if I would be happy with the results, and I couldn't be happier. He promised me in the beginning that he doesn't believe in overdoing. His goal is just to make you look rested, not necessarily younger, but rested, and just take away some of the signs of aging.
And we don't want anyone to be walking down the street looking awkward. It's better to have loose skin than to look awkward. So that's a very, very important aspect of what I call a male facelift. When I saw Richard in our post-operative evaluation about a month after his surgery, I mean, it was an unbelievable appearance in a sense. He looked great, he looked natural, he was happy, I was happy. So he was ecstatic. I think we achieved everything we wanted. We got a nice improvement in his neck. He still looks like Richard.
I think that the thing I feel the most is I feel a little bit more confident. Not that I felt bad, because Dr. Azizzadeh said from the very beginning I had the right attitude for doing this. I felt fine about myself on the inside. I didn't feel like my face was matching the way I felt about myself. And now I feel like I do. I just feel very comfortable with the way I look.